So in the early studies that we're seeing from a few different countries, we are seeing the odds of being hospitalized during the Omicron variant circulation versus during a Delta period circulation to be reduced. So that means a reduced risk of hospitalization with Omicron infection when compared to Delta. And that reduction as well is being seen with the severity of the disease being observed.
Good afternoon to everyone. There are reports on mostly...
While Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild. Just like previous variants, Omicron is hospitalizing people and it's killing people. In fact, the tsunami of cases is so huge and quick that it is overwhelming health systems around the world.
But at this moment it's very important. What message could WHO...
To end the acute stage of the pandemic, the highly effective tools science has given us need to be shared fairly and quickly with all countries of the world. Vaccine inequity and health inequity overall were the biggest failures of last year.
Mute yourself and ask your question.
Happy New Year to all.
Vaccine inequity is a killer of people and jobs, and it undermines a global economic recovery. Alpha, Beta, Delta, Gamma, and Omicron reflect that in part because of low vaccination rates, we have created the perfect conditions for the emergence of virus variants.
And firstly, could you tell us the WHO's assessment?
At the current pace of vaccine rollout, 109 countries would miss out on fully vaccinating 70% of their populations by the start of July 2022. The essence of the disparity is that some countries are moving toward vaccinating citizens a fourth time, while others haven't even had enough regular supply to vaccinate their health workers and those at most risk. Booster after booster in a small number of countries will not end a pandemic while billions remain completely unprotected. But we can and must turn it around.
Eaton from Associated Press. Jamie, please unmute yourself and ask your question.
And the numbers we're seeing from some countries are staggering, right? Of the patients with severe disease, up to 90% of those are unvaccinated. So clearly these vaccines are having a huge impact. So to Mike's point, the big goal is take the heat out of this thing, make this thing a more, let's say, almost normal disease, if we can say such a thing. And we have the tools to do that. It's how we distribute them. So as we look forward to that goal of 70% of the population vaccinated in every country, the first step has got to be 10% in every country. 36 countries still aren't there.
For those questions, we'll now go to Mexico, to Manuel Lino from EJE.
The earliest detection of this variant was detected in September 2020 in a number of countries. And there was a preprint that was published coming from our researchers in France recently. This variant has been discussed with our technical advisory group on virus evolution, and it was characterized as a variant under monitoring in November 2020. And this variant does have a large number of mutations. Our understanding, it's not very well circulating. Within France, less than 1% of the samples that were sequenced in France are of this particular variant. There's two sublineages of it, the B1640.1 and the B1640.2. We classify both of those as a variant under monitoring.
Or a Delta variant, or could you please describe the role of the two Chinese